Welcome back, YouTube, to my channel. Tony here, board certified adult gerontology nurse practitioner, primary care. And have you ever wondered how many nurse practitioner specialties are there? Stay tuned.
Stand clear of the closing doors, please.
Hey YouTube, thanks for coming back and checking me out here on my channel. If you like what you see, hit the thumbs up button. If you have a colleague, loved one that can benefit from this information, share it with them. And of course, subscribe to find out more and to learn more. When you hit subscribe though, hit the bell icon and then go a little step further and make sure you hit the all selection because it defaults to personalized and YouTube may not always send notifications. So this goes across the board. Any YouTube channel that you're subscribed to, you're wondering why you're not getting all your notifications. Could be why. So just hit the bell icon and make sure you select all. Today we'll be discussing the tracks that you formally go to school for and get a degree in to sit for a certification board exam to practice. Go on and practice, do your thing. I'm going to throw some sub-specializations in there. Once you're board certified in your area of expertise, there's even more nuances that you can sit for and just demonstrate your expertise in different fields. I made a video last time about the gerontological specialists that one can take once they are a board certified nurse practitioner, but there are many others out there. You just have to explore, research, and you'll find what you need and what you want. The first nurse practitioner specialty I'm going to be discussing, we're going to go A through Z here to make it life easier for me. The first one is going to be the adult gerontology acute care and or primary care nurse practitioner. These are two separate specialties, so just know. Adult gero acute care is usually seen as ACNP or acute care nurse practitioner. Just know that it's for acute care settings, namely mainly hospitals, acute care hospitals. I believe you could probably work in long-term acute care hospitals, but I'm not sure. Don't quote me on that. But just know that usually people with this certification work inpatient. Primary care, by virtue of the name, they work mainly outpatient. Not to say that primary care AGNPs cannot find a job in hospitals. Hospitals will hire you, like I mentioned in my very first video. But just know that your training did not prepare you to be an acute care provider. Just so you know, I don't want to backtrack too much. All right, so the AGPCNP, you got two options to sit for boards, two certifying bodies. One is the American Academy of Nurse Practitioners Certification Board. The other is the American Nurse Credentialing Center. Did I get that right? Yes, American Nurses Credentialing Center, or ANCC. When it comes to the acute care side, you have two options as well, one being ANCC or the American Association of Critical Care Nurses, AACN. All right, next up on the list is the Emergency Nurse Practitioner. Now, that is offered through two certifying bodies. ANCC, once again, starring as one option. The other, once again, AACN, the American Association of Critical Care Nurses. Now, the one thing I learned about the Emergency Nurse Practitioner certification is, let's say you're an ER nurse. You've been working in the ER for quite a while, and you decided it's time, go back to school for your FNP, Family Nurse Practitioner. That's coming up next. And you decide, of course, the emergency nurse practitioner comes out after you got your FNP. And it's like, wow, I really want that certification. You don't necessarily have to go back to school to become an emergency nurse practitioner. Now, if this has changed recently, I'm not sure, but when I looked this up about 6 months ago, I heard it from another YouTuber, and then when I looked it up, I saw it's true that you don't actually have to go back to school like most other nurse practitioner specialties. You have to go back, get postmasters or whatever to get another nurse practitioner specialty. So with the emergency nurse practitioner, if you have ER experience as an RN, you actually could use that experience and that knowledge along with other resources and sit for the ENP exam just like that. If you already have a nurse practitioner licensure, certification, board certification. If you don't, then you have to go to school for it. But just letting you know, if you want to find out more information, I will put the links for all these certifying bodies in the description, so you can just click on the link and go exploring on their website for all the different nurse practitioner certifications that are offered. All right. Next is Family Nurse Practitioner, or FNP, probably one of the or the most popular nurse practitioner specialty. As we all know, they see everyone from birth to near death. And there are two certifying bodies, once again, similar to our AGPCNP colleagues. We have the AACN, the American, no, I'm sorry, not the AACN, the ANCC. There are too many letters, okay? American Nurses Credentialing Center. And also the AANPCB, American Academy of Nurse Practitioners Certification Board. All right, so you got those two options. Next, we have the Neonatal Nurse Practitioner. Not really a popular one on YouTube. I did a search and it's hard to come by, but there is such a thing. Neonatal nurse practitioners, they work in none other than NICUs. So their certifying body is the National Certification Corporation. All right, go to their website, find out all you need to know about becoming a neonatal nurse practitioner. Next up on the list is the psychiatric mental health nurse practitioner. Now, in my research for this video, I found that years ago it was, I guess, divided up into adult and family, but they retired the adult specialty. People who are already adult psych mental health nurse practitioners can continue to research with the exam, but you cannot become one now. It's strictly family psych mental health nurse practitioner. So by that title, I'm assuming you see everyone from birth to near death with psychiatric issues. So their certifying body is only one. You guessed it, ANCC. They hold a lot of certification choices, not only for NPs, but RNs as well. So check out ANCC's website for more about the psych mental health nurse practitioner certification. Next on the list, we're almost done, is the pediatric nurse practitioner. Just like adult Gero, you got a primary care track and an acute care track. All right, so pediatric, self-explanatory, either acute care or primary care. For the acute care track, you have one option. That's PNCB. That is the Pediatric Nursing Certification Board, okay? Excuse me, I gotta use cheat sheet here to remember all these letters and alphabet soup. So, for the primary care, you have two options. PNCB, once again, or ANCC, all right? So those are the two options for the pediatric nurse practitioner primary care, but for the acute care track, only PNCB, Pediatric Nursing Certification Board. And last, but certainly not least, is the Women's Health Nurse Practitioner Certification. There's only one certifying body for the Women's Health Nurse Practitioner, and that is the National Certification Corporation, NCC. Remember them when we discussed, what was it? Oh, neonatal nurse practitioner. So NCC offers the neonatal nurse practitioner and the women's health nurse practitioner certifications. So check out the NCC to find out more. Now, as a board certified nurse practitioner, depending on what area you're working in, you may find a love. You found your passion, you found your niche, and now you want to just learn even more and just get more knowledge and take another exam. Okay, maybe not, but sometimes you want to take further steps to solidify your knowledge, to demonstrate your knowledge to patients, to their families, to your colleagues, to your employer, or to yourself, and just take on another certification. Well, you know how they say there's an app for that? Well, there's a certification for that. Okay, so I discussed in my last video the gerontological specialist certification for those who just want to dig deeper into the care of the older adult. I just touched the surface, tip of the iceberg. So here are a few that I came across. The ACHPN, or Advanced Certified Hospice and Palliative Nurse. For those NPs who have found a love in working in the hospice and palliative care field, this might be something you might think about getting. All right, another one I found in my search is one in oncology, and that is Advanced Oncology Certified Nurse Practitioner. There you go. For those who have a love in oncology and have a strong interest in it and learning about it, all the intricacies and how they can further help their patients and their loved ones as they battle with various types of cancer. Okay. Another one I came across by the American Board of Cardiovascular Medicine is the Cardiac Nurse Practitioner, or CVNP. Side note, there's also CVPA. So any PAs watching this video, boom, there you go. But anyone working in cardiology, I say primary care or acute care. I have a love for cardiology, a secret love for cardiology. But if you really are into cardiology and you work for a cardiologist or a CT surgeon, you may want to consider getting a certification from the American Board of Cardiovascular Medicine. And the last one I'm going to share with you is the Orthopedic Nurse Practitioner. This, I believe, from my research, is fairly new. I say 2017, 2018. They had Orthopedic Nurse, but now they have Orthopedic Nurse Practitioner -C, I believe, or is it BC? One of those. But you go to the Orthopedic Nurse Certification Board, I think is what it's called. Yep. And hey, scratch what I just said. The ONPC has been around since about 2007. So once again, just check out their website and learn more about this certification. Or just Google Orthopedic Nurse Practitioner and you will go straight to the website that will give you more information about becoming even more certified, if you will. All right? That is it, folks. I hope you enjoyed this video about all the various types of nurse practitioners there are and that you can become one day, and if you want to keep going and just keep getting more postmaster certificates until you just run out of money, go for it. Yay! Anyway, I hope you enjoyed. Hit the like button, share, subscribe, and I will talk to you soon. Bye.